Hi, my name is Kira Kneller, and this is Christy Field and Ginger Nicolai, and we are drug and alcohol counsellors with ARC programs. ARC programs provides a range of services for children, youth and families in the interior of BC. We all work in School District 23 in Kelowna as drug and alcohol counsellors. We provide one-on-one counselling in middle and high schools, as well as provide community education. The Parent Survival Kit, titled How to Talk to Your Teen About Drugs and Alcohol, has 4 modules. Each one is about 15 to 20 minutes long. The information is intended for parents or caregivers. However, it will be applicable to anyone wanting to better understand youth and substance use. These presentations are not inclusive of all the information about drugs and alcohol. However, they will help you get a basic understanding of teens and substance use. Here is a brief description of each of the 4 modules.
In the last 3 modules, we have discussed why teens are using and some basic information about a few drugs of concern. In this final module, we will look closer at how to know if your teen is using, understanding their level of use, and how to engage with your teen about drugs and alcohol, including some common parent concerns. So how much risk is involved in using a drug and how much harm it may cause depends on a number of factors, such as how much they are taking. So of course, if somebody is using a greater amount or using more frequently, or at a higher concentration, such as tolerance, there is an increased risk for that. Somebody who's using at a younger age, as we've mentioned throughout these 3 modules, is that the younger the person starts using, the higher risk they are because of the high rate of brain development happening and the potential impact it can have on those brain areas. And where and when your teen is using to use influences their risk. So drinking a glass of wine at a family event and then playing chess with grandpa is a lot less likely to result in harm than sneaking alcohol with a group of classmates and then go riding bikes or going skateboarding or going to a bush party where people aren't able to access them if they need help. As we mentioned in Module 1, the reasons why a young person is choosing to use is very important. So when a person uses a drug because they are curious, they're much more likely to use it only occasionally or for a short time. But when a person uses a drug to deal with long-term problems, they may use the drug too much or too often because they are experiencing a benefit from it.
So how do I know if my teen is using? You know your teen best, and if you begin to notice significant changes in your teen or are worried about them struggling with something, listen to that gut instinct. And remember, it's not about catching them using, but rather about finding natural opportunities to engage in conversation. Determining if your teen is using can be difficult since it is common for teens to have irregular sleep schedules, such as going to bed late or sleeping in. They focus more on their peer friendships than on their family connections. They tend to make new friends and lose friends quite regularly. They experience mood swings and emotional outbursts, and they may even have challenges at school or not enjoy school at all. However, when a teen is using alcohol or drugs, these common teen behaviors are exacerbated. So they're skipping classes, they're not completing their homework, their grades are dropping, they might become more secretive about what they're doing or who they're with or where they're going to be. They suddenly might have a completely new group of friends. They might have abnormal health issues arise, such as weight loss, nosebleeds, vomiting, bloodshot eyes, or depression or anxiety. You might see a significant deterioration in relationships with family members, or even changes in their behavior, such as poor hygiene, avoiding eye contact, breaking curfew, or having significant shifts in their energy levels. They may even be stealing alcohol, cigarettes, money, lighters, or household items to use or to sell. And not only is it sometimes difficult to tell if they're using, it is also difficult to tell how much they're using. And we may, out of fear or misunderstanding, assume that our teen is addicted to drugs. So understanding the levels of use can help you to better support your youth with their substance use. The levels of use fall on a continuum with no use at the far left and addiction or dependence at the far right. And most youth, their substance use is towards the left, so no use or experimental use. No use is when your teen is not using that substance and they don't really have an interest in using it. While experimental use, your youth has tried the substance a few times and may or may not continue to use. Most young people try drugs for the first time as an experiment, usually because their friends are doing it, and it tends not to last long and doesn't happen very often. And it kind of depends on how easy it is to get the drugs, where it's happening, their friends, their beliefs about drugs, and the current trends in the community. They may move to the next level, which is irregular use, or they may stop once they've satisfied that curiosity. The main risk of experimental drug use is that young people may not know the effects of the drugs that they're trying, and they may not know how much to use or what an overdose looks like, which could be lethal. Irregular use, your youth has used the substance more than a few times, but there's no real pattern or predictability to their use. For example, they may drink at a party, but sometimes they choose not to. Whereas with regular use, there's an element of predictability or there's a pattern to their substance use. For example, they smoke weed every weekend, or they vape every lunch hour, or they drink at every party. Harmful use or abuse is when the drug use is interfering with the person's ability to function in life. So it's affecting their health, their relationships, home life, school, or work, and they may become involved with the legal system. Dependence or addiction is when the user spends the majority of their time and energy trying to get money for the drug, find the drug, use the drug, withdraw from the drug, and then start the cycle over again. Their main focus is their substance use. So keep in mind, a person can be at different levels of use if they're using more than one substance. For example, your teen may be a regular use for smoking weed and harmful use for cocaine. So some helpful questions to ask your teen are, what level of use do you think you're at? And what are you liking about using, and what don't you like about it? How is it helping you accomplish your goals? And look for or explore any ambivalence or talk about wanting to change their use. Try to keep these levels of use in mind while we discuss how to talk with your teen about their use on the next slides.
Nearly 2/3 of teenagers see great risk of upsetting their parents or losing the respect of their parents if they smoke marijuana or use other drugs. This is an interesting quote which leads into the importance of talking to your teen about substance use and opening up that conversation for them. If you're planning on talking to your teen about substance use, whether they are using or whether they're not using, if you're trying to prevent them from using, if you're having a conversation with them, I think it's important to just ask yourself, what are my goals before I talk to my teen about that? And you even write down your goals before you go into that conversation, just so you can remind yourself as you're talking. Is your goal, I'm just trying to open up the door to have an ongoing conversation about drugs? Are you wondering if your child is feeling pressure to use drugs? Are you even unsure what your teen's views are on drugs? Or are you even just wanting to let your child know your concerns about their use and fears about drugs? Gaining an understanding of the pressure your teen is feeling around drugs with friends or at school will give you a little more insight on what's going on for them. And also, before you're having this conversation, if you're in a two-parent family, go to the other parent, get on the same page with them so that you're both on the same page before talking to your teen about drug use. Before you have a conversation, it's always a good idea to have plan out that conversation so that it's happening in a comfortable setting, or use a natural opportunity to open up that conversation with your teen. For instance, if there's a news story on about fentanyl, if there is a news story on about, the legalization of marijuana, if you're walking past a group of people and they're smoking, or you smell weed, use those opportunities to have conversations about how your teen feels about those things and how you feel about those drugs and any concerns you may have. Let your teen know what you're hoping to get out of talking to them about drugs. Let them know your concerns, but you're also open to hearing their perspective. Be curious with them, ask questions. Being non-judgmental and curious can go a long way in terms of creating a safe space for your teen to talk about drugs. And it also might give you a better understanding of the challenges your teen is facing and how you can support them. Listen to any issues that your teen is having, and be aware of your body language and your tone. If you're feeling like you're getting stressed out, if you're feeling that you are not okay with what your teen is saying, you're not sure how you're going to be reacting, take a break, go to the bathroom for 5 minutes, come back when you're feeling a little more calmer and you're able to have a conversation with your teen about this. There's not always an easy conversation to have, so make sure you're prepared and that you're listening to your teen.
Let's go over some common questions and concerns that parents often mention. So what if my teen has incorrect information about drugs? Encourage them to search medical or health websites, or if you're not able to find the information, talk to a drug counselor, see if there's websites or resources in the community that can help. What if your teen says it's helping them? Validate their experience that it may appear to be helping in the moment and discuss what the drugs are helping with. For example, is it helping with depression, anxiety, socializing, hyperactivity, or stopping their thinking? And explore other ways to address their concern, for example, talking to a doctor or counseling, or do they need more parental support? What if my teen would rather use weed than medication for mental health? Validate their concern and their interest in being healthy and discuss options for dealing with their mental health concerns, such as counseling. If they argue that weed is natural, so it's better for you, remind them that not all plants are healthy or good for you. For example, heroin and cocaine are both derived from plants. And emphasize that there are pros and cons to both marijuana and prescription pills, and engage them in brainstorming possible risks and benefits. Ultimately, we want to help with any mental health concerns so that they're less likely to use drugs to feel better or feel good.
Continuing with some common parent concerns. So what if your teen tells you that they are using drugs or using more than you thought? First, it's important to acknowledge that and appreciate their honesty in entrusting you enough to talk about their use. Communicate that you're worried for them and want to understand their use. Remain curious, ask questions, and listen for ways that you could help, especially around the reason that they are using. Understanding what they are getting from their use can highlight opportunities to look at alternate ways to meet those needs, such as to feel better can mean that they may be feeling low, anxious, or experiencing mental health concerns that could be treated by the family doctor or a counselor. And continue to brainstorm ways to reduce the risk of harm associated with their use, such as reducing how frequently they're using, how much they are using, or having access to safe materials, especially if they're choosing to use IV drugs. So our last common parent concern is, what if my teen says everyone is doing it? This is something we come up against very commonly as counselors. So it's important to validate their feelings, and it can seem like everyone is doing it if they are spending time with others that are using as well. As humans, we seek out people with similar interests, and therefore teens will typically spend time with other peers who are using or experimenting themselves. Drugs and alcohol are also a common topic of interest for teens as they are trying to navigate their identity, take risks, and understand consequences, so it can often feel like everyone is doing it. So your role as a parent or a caregiver is to do some research. Use the stats shown in our first module to demonstrate that in reality, not everyone is using. In fact, marijuana use has actually declined over the last 10 years for teens. And continue to engage in an open conversation about the potential impacts that drugs and alcohol can have on their brains, the difference between teens and adults, and the increased risks associated with that.
So wrapping up that module, we'd just like to provide you guys with some supports that are available if you'd like to find some more information out. This slide provides a bunch of different websites on mental health, some on specific drug information. MindCheck, one of those apps at the bottom there, is a great mental health based app, and it provides different mental health websites that are available for you and your youth. MindShift is another great app. It's designed to help teens and young adults cope with anxiety. It provides different strategies to help with relaxation, positive thinking, generally just active steps to manage anxiety. Good to Go is an app-based quiz, and it helps assess ability to drive under the influence of alcohol, marijuana, or emotional distress, and also provides information about the impact of various substances on your ability to drive. Saying When, that's that last app, it helps reduce or quit drinking alcohol by helping tracking your alcohol use. It helps identify triggers and strategies that have also helped you quit in the past or cut back. On this next slide, this is some community supports that might help you if you're looking for further information. Feel free to check those out, or their websites. And this last slide just provides some of the references that we provided you throughout the module. Check those out if you're looking for some more detailed information. Thank you.